Hi, my name is Dr. Cyrus Kump. I'm an orthopedic surgeon specializing in total joint surgery with advanced orthopedics. So orthopedic trauma is, of course, usually from an accident, unexpected. We usually see fractures of the extremities. Sometimes this may involve the joints. With open injuries, we can also have lacerations to the skin, obviously, but also tendons and injuries to the ligaments. Depending on the particular injury that the patient has suffered would determine the proper treatment, of course, in a traumatic situation with fractures or ligament injuries or tendon injuries. Usually there's an evaluation in the emergency room where, depending on that injury, we might start the treatment at that point to include IV antibiotics, cleaning of the wound, possibly suturing of the wound at that point. If it is a fracture that involves a joint or a long bone, of course, we would attempt a reduction in the ER under very good anesthesia. Failing that, or should this require further treatment, such as open treatment, that would probably be scheduled for a later time, and the patient could be admitted, depending on the injury, for further management of discomfort or evaluation, and then brought back at a later time for the definitive orthopedic surgery, which could include placement of plate and screws to get the best alignment of a fracture and repair of any other soft tissue. The length of recovery for an orthopedic injury obviously depends on the significance of the injury, or the depth of the injury, and how many injuries a patient may have. Obviously, the more areas that are injured, or if it's a larger bone, say the pelvis or a femur fracture, the length of recovery is longer, but maybe an injury to the wrist, a hand, a hip, an ankle, they may not be as long of a recovery. And in some situations, we can fix fractures where the patient can walk immediately on the injured extremity, or use the injured upper extremity, in which case.